Varicose veins are usually caused by weak vein walls and valves. Inside your veins there's tiny one-way valves, and these open and let blood through, and then they close to prevent it from flowing backwards. Sometimes the walls of the veins become stretched and they lose their elasticity. This causes the valves to weaken. The main cause of varicose veins include being female, being older, pregnancy, long periods of standing, obesity, genetics, smoking, and being inactive. Varicose veins are abnormally enlarged veins. They occur anywhere in the body, but they're usually found in the legs. When left untreated, varicose veins can sometimes cause high blood pressure, or they can even cause a sudden, serious drop in blood pressure, known as orthostatic hypotension. This drop in blood pressure, when going from lying flat to a standing position, may be partially due to the pooling of blood in the varicose leg veins. Horse chestnut extract appears to impair the action of the platelets, which are the important components of the blood clotting. It also inhibits a range of chemicals in the blood, including cyclooxygenase, lipooxygenase, and a range of prostaglandins and leukotrienes. These effects result in reduced inflammation and reduced blood pressure. Horse chestnut seed extract has consistently shown benefits for the short-term treatment of varicose veins. Since treatment for this condition will need to continue for many years, long-term studies are needed. The extract has been safe in the short-term studies. Essential oils extracted from the yarrow plant have been used traditionally for treating varicose veins. When a person applies yarrow to the skin above the varicose veins, it may help to reduce their symptoms. A yarrow tincture can also be taken internally. Regularly getting exercise is one of the best things that you can do to improve blood flow and to lower inflammation, which you can add to the extensive list of exercise benefits. The National Heart, Blood and Lung Institute states that sitting, especially with poor posture, like forward head posture, or your legs crossed, or standing for long periods of time without moving, is associated with an increased risk of varicose veins and other forms of blood pooling. When you stay still for too long, it's harder for your veins to pump the blood efficiently back to your heart and to fight the effects of gravity. Exercise is also a great way to help to balance hormones naturally, to lose weight or to maintain a healthy body weight, and lower blood pressure, which can all contribute to varicose veins. The Carolina Vascular Institute recommends preventing varicose veins by performing leg lifts, calf raises, bicycle legs, and side lunges to strengthen and to stretch the veins around the legs. Low-impact exercises like walking, swimming, and cycling are also ideal for varicose vein sufferers since they help to alleviate the pressure. People who are overweight are more likely to develop varicose veins, especially overweight women and elderly people. Carrying excess body weight puts higher amounts of pressure on your veins, and it can contribute to inflammation or reflux, especially in the largest superficial veins, such as the saphenous vein in the leg. According to a report published by the Huffington Post about the connection between obesity and varicose veins, for overweight people, varicose veins are often more difficult to assess and to treat because they're commonly unnoticed until they progress to more inflamed and larger sizes, up to 4 to 5 centimeters long, deep inside the leg. Certain foods help to reverse inflammation and to improve blood flow, making it possible to heal the varicose veins faster and to prevent future ones from forming. A poor diet, high in things like trans fats, sugar, caffeine, alcohol, and processed foods, can contribute to arterial damage, low circulation, blood pressure problems, hormonal imbalances, and weight gain. Many of these foods are also high in sodium, which is dehydrating and contains toxins that can worsen the swelling in varicose veins. For reducing the appearance of varicose veins, fiber helps to improve heart health, and it's also necessary for healthy digestive function. Eating 30 to 40 grams of fiber every day is a great way to prevent constipation, which can cause bloating and increase pressure around the veins. the abdomen and the legs. High fiber foods to eat include chia seed and flaxseed, which are also omega-3 foods, which are natural anti-inflammatories. Vegetables, fresh fruit, and soaked and sprouted legumes and ancient grains. Antioxidants like flavonoids present in berries, vitamin C and vitamin E, both present in green vegetables and citrus fruit, help to strengthen veins, fight inflammation, and improve arterial health. Vitamin E is known to help to prevent clots and acts like a natural blood thinner, and is tied to heart health. Vitamin C is a powerful anti-inflammatory, and it's beneficial for skin health. Doctors sometimes use diuretic pills to help to increase urination and reduce water retention or swelling. You can get the same effects safely by consuming things like fresh herbs, like parsley, basil, fennel, dandelion, cucumber, asparagus, and celery. Don't take large doses of diuretics without medical supervision, as it can cause problems such as a potassium deficiency or an electrolyte imbalance. Blood pooling, blood pressure problems, and leg cramps, like restless leg syndrome, are warning signs of deficiencies in electrolytes like potassium and magnesium. To overcome these symptoms, increase the intake of things like leafy greens, avocados, bananas, cruciferous vegetables, and sweet potatoes. You can take magnesium in the form of magnesium bisglycinate for best results. Start by increasing the dose gradually until side effects like diarrhea or stomach upset is noticed. Then slowly reduce the dose until you're able to determine your maximum daily tolerable amount that doesn't cause any of this digestive disturbance. As magnesium is required by over 300 enzymatic processes in the body, it can have profound health benefits after a few months of use. Foods with spices like cayenne pepper or curry help to heat up the body and get blood flowing, adding to the healthy circulation and even appetite and weight control. Foods high in omega-3 fatty acids have been known to help blood vessels open, lower blood pressure, prevent blood clotting, and most importantly, benefit varicose veins. Fish and seafood like wild salmon, mackerel, anchovies, sardines, and tuna provide omega-3 fatty acids. You could also take 3 to 9 grams per day of an omega-3 EPA/DHA fish oil blend. Apple cider vinegar improves circulation in the vein walls, and it's an effective anti-inflammatory. Many people find that using apple cider vinegar along with witch hazel on the varicose veins helps to lower the swelling, and it improves the appearance within just a few weeks. Hawthorn is one of the many plants that contains flavonoids, which are compounds that can improve circulation. Flavonoids are found in many plants like cranberries, hawthorns, blueberries, and others. Several studies suggest they may reduce the leakage in the veins and the swelling in the legs. Flavonoids such as quercetin has been shown to improve the action of vitamin C, shikimic acid, and zinc. Therefore, it appears to be an important cofactor in proper health. Quercetin is found in elderberry juice. Vitamin C is known for preventing cell damage thanks to its antioxidant properties. These properties promote collagen production as well as strengthen blood vessels. Both of these things help to prevent varicose veins from worsening. The best form of vitamin C is a liposomal vitamin C. You can learn how to make liposomal vitamin C cheaply in an ultrasonic cleaner. The next best form would be a non-acidic pH buffered vitamin C, with the worst kind of vitamin C being cheap ascorbic acid. A study has shown for the first time that lowered serum zinc levels is one of the factors that induces the itching caused by varicose veins, so it's suggested that zinc supplementation may be an effective treatment to help alleviate the itching and to improve the quality of life in these patients. Typical doses of zinc are 30 to 50 milligrams per day. Be sure to have an absorbable form of zinc, as many forms are poorly absorbed. Turmeric is a blood cleanser. It inhibits blood platelet aggregation and it leads to thinner blood. This is especially useful in treating varicose veins. It can be eaten or juiced. However, the best effect would be from a curcumin extract. A typical dose of curcumin could range from 2 up to 5 grams per day. Due to its low bioavailability, it's advised to take it with either biopterin, which is black pepper extract, or with an oil such as butter, ghee, coconut oil, or fish oil to help to increase its absorption. Coenzyme Q10 improves circulation and tissue oxygenation. The best form is ubiquinol, taken in doses of 200 to 400 milligrams per day. Varicose veins have been linked to an increased risk of blood clots, and vitamin E prevents platelets from sticking to blood vessel walls. If your leg cramps are from constricted veins, a dose of vitamin E can help to reduce the discomfort. Mixed tocopherols are the best form of vitamin E. Data published in the International Journal of Angiology indicated that the pine bark extract may significantly improve the appearance, the swelling, and the discomfort of pregnancy-induced varicose veins and spider vein clusters. Grapeseed extract is a natural remedy often recommended for chronic venous insufficiency. Some proponents of grapeseed extract suggest that the antioxidants found in the grapeseed can help to fight chronic venous insufficiency by strengthening the blood vessels and by improving circulation. Garlic is well known for its beneficial impact on circulation and heart health. Studies suggest that garlic, specifically its sulfur-containing compounds, which include allicin, increase the tissue blood flow and that lowers blood pressure by relaxing your blood vessels. People with varicose veins tend to have an impaired ability to dissolve fibrin. This is where ginger saves the day. It's been found out that the ginger can improve the circulation by dissolving the fibrin that pools in the blood vessels. Vitamin D helps to keep your arteries and your blood vessels loose enough and relaxed enough to support the proper blood flow. So, when vitamin D levels are low, your veins struggle to do their job properly and vein issues arise. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly to correct any deficiency with vitamin D3. Vitamin K has been increasing in popularity in preventing varicose veins. It's recommended to use it topically like a cream. Vitamin K is an anticoagulant, meaning it helps to prevent blood clots and to keep blood flowing smoothly through the veins. For internal use, the best form of vitamin K is K2 as MK7, with typical doses ranging from 100 to 300 micrograms per day. It works synergistically with the vitamin D. For more information about the herbs or supplements mentioned in this presentation, check out my website.